Hello everyone and welcome to today's Connect and Learn webinar. I'd like to begin by acknowledging the traditional owners of the land on which we meet today and pay my respects to their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples listening today or in the future. My name is Rebecca and I'll be facilitating today's webinar on cannabis consumption and parenting, rethinking the evidence. This webinar is part of a series of Connect and Learn webinars designed to support AOD clinicians throughout Victoria. The series is funded by the Victorian Department of Health and hosted by Turning Point. We do want to try and make this as interactive as possible, so please do ask your questions when you think of them via the Q&A function, not the chat function. I'm going to collate the questions for our presenter and ask them at the end. Please be aware that our webinars are recorded and are later made available on the Turning Point website. We encourage you to stay to the end of the webinar and complete the exit survey when the QR code appears on a slide, the last slide. We'll also send it to you via email later today. Unfortunately, we're unable to share the slides from this presentation. Not all of the information is published yet. I'd like to introduce our presenter, Dr Tristan Duncan. Welcome, Tristan. Tristan is a research fellow at Turning Point and Monash University. His work explores experiences of alcohol and other drug consumption and service delivery using social science methods, with a particular focus on gender and practices of care. Tristan has previously worked within AOD and homelessness services, where he has delivered and developed a variety of harm reduction initiatives. Thanks, Tristan, so much for joining us today, and I'll pass it over to you.
Awesome. Thanks, Rebecca, and thanks everyone for tuning in today. My name's Tristan, as mentioned. I'm a research fellow at Monash Uni and Turning Point, where I work as part of the clinical and social research team. And prior to being here, I cut my teeth in the homelessness sector and the alcohol and other drug sector, working in spaces like injecting rooms and drop-in services. And my research is really shaped by those experiences. It's dedicated to working out how we can better understand alcohol and other drug use, how we can better respond to these alcohol and other drug-related harms in a manner that's consistent with the needs and the desires of people that use drugs, and that also tend to the social structural conditions that co-produce harms and inequity in our community. So today I'm going to be continuing on with that thread, hopefully. We're going to be looking at the topic of cannabis consumption and its relationship with parenting and parenthood, specifically how it's been grasped in the academic literature and some of the implications of that work for how we think about and respond to parental cannabis use. So a little bit of an overview. I'll start by highlighting what might be termed a newly framed concern for cannabis use among parents. We're going to be looking at how and why it's been positioned as a distinct kind of problem. We'll be looking at the academic evidence on the topic with a view, as mentioned, to highlight the limitations and assumptions at play across that work. I'll then move to share some of the early analysis that we're working on, some research that we're doing involving parents and their experiences of cannabis use in the context of family life. And I'll caveat that here by saying it is a work in progress. It's ongoing, but we think it can serve as a useful device for questioning some of the evidence that's out there already and maybe pushing it in new directions. Lastly, I'll draw out the implications of our analysis and our review of the literature for how we move forward with respect to the topic of parental cannabis use. Some context here. We know that the cannabis policy landscape has undergone quite a relatively rapid process of change within the last 10 to 20 years. We're seeing a number of countries globally legalize recreational marijuana consumption. So in Canada and multiple parts of the US, other countries have announced their intention to legalize cannabis consumption on a recreational basis, like Germany. And then we have some countries trialing the legalization of cannabis, like Switzerland. Decriminalization is on the move to some extent, and globally, medicinal cannabis and the legalization thereof is also expanding. If we take a look more locally within Australia, some of the trends are evident here too. In 2016, the federal government legalised the cultivation and manufacture of medicinal cannabis. And since then, we've seen various changes, the streamlining of state legislative policies and processes to improve medicinal marijuana uptake, legalization of cannabis for small amounts in ACT. And then recently, perhaps what's indicative of a potential ideological shift in our approach to cannabis in Victoria, the recent inquiry into the use of cannabis, suggesting that the matter be treated as a health issue as opposed to its traditional positioning as a criminal justice one. The report also recommended that the government look into the impacts of legalizing cannabis. A word on prevalence. This is data drawn from the 2019 National Drug Household Survey. What we know is that cannabis has been consistently identified as one of the most commonly used illicit drugs in Australia. So around about 36% of the population, or 7.6 million people, have indicated that they've used cannabis in their lifetime. 11.6% have used it recently, that being within the last 12 months. Of that group, around 37% consuming weekly or more. The majority categorised as low risk of being dependent or experiencing severe problems. That only is around about 2.9% of that population. It's a mixed bag in terms of who's smoking according to socioeconomic status, but there are similar rates at the national level between those using cannabis on a regular level between the most and least advantaged areas. Data on among parents is a little bit more difficult to locate. I'd be eager for any suggestions around this, actually. If we look at the survey again, it suggests that 8.7% of couples with dependents have smoked or consumed cannabis recently, and almost double that amongst single parents with dependents. But I note here that dependents are defined in that survey as not only children aged 0 to 14, but also older children who are still financially dependent. So we don't really get a really clear or accurate sense of who those parents are. Looking at gendered distributions a little bit more closely, it's relevant for the analysis that precedes. We can find that men are more likely to report recent use than women. And that difference is almost 2 times amongst those in their 30s. And I find that interesting as men and women within Australia are now more likely to have their first child in their early 30s. So maybe a little bit of a proxy measure for who might be or which parents might be consuming cannabis. We can see that the majority of people smoking every day, once or weekly or more, and every few months are actually men, and women every few months or once or twice a year. Right, so against this backdrop of cannabis consumption and law reform, what we're seeing is the links of cannabis use and parenting becoming subject to growing public health attention as well as scrutiny. So it's kind of moving out of the shadow of being lumped in with this generic category of parental substance use, which has long been a side of anxiety and concern, and being foregrounded in isolation. And much of this might be understood to dovetail with concerns around the increasing normalization or acceptance of cannabis use, as well as in North America, reported increases in cannabis use amongst pregnant women and women of reproductive age. So across public health resources and government guidelines, we're seeing cautioning against cannabis use while parenting, particularly in the breastfeeding period. And in research, we've got scholars calling for greater clinical surveillance and monitoring of parents who are consuming cannabis. So, for example, some French researchers here on the bottom, emergency physicians should be aware of the increased risk of child abuse when parents are cannabis users. All right, so looking at a handful of cannabis-specific parenting resources from Australia and Canada, we can see how these concerns are mobilised around a series of claims regarding the relationship between postpartum cannabis use and parenting capacity. For example, a resource here from the Royal Women's Hospital in Melbourne suggesting that cannabis use might undermine your ability to provide safe care to your child and your relationship with it, that it can precipitate family arguments and affect personal relationships, that it may affect the emotional development of your baby by making you less aware of their needs. And then on the right, some similar claims that cannabis use can impair your ability to identify and respond to your child's needs. And so too might it affect parent-child attachment and your capacity to make good decisions. On the far bottom right there, we also see an emphasis on the imperative to make the most of your relationship with your child, which in this context appears to insinuate that cannabis use might be at odds with doing so. So without necessarily questioning the veracity or the usefulness of these claims and these resources, what I'd now like to do is turn towards the academic literature on the topic. What does it actually tell us? What have they explored? And if we look at a number of statements made recently by scholars in published research in this area, the evidence base on parental cannabis use is deemed to be quite limited, inconsistent, and conflictual. And it appears we actually don't have a great deal of knowledge surrounding the effects of cannabis use on parenting and children, much less a firm understanding of the mechanisms or the causal pathways through which these effects might be understood to emerge, which is quite curious. As social work scholars Saheim and colleagues pointed out in a recent piece from 2023, it's actually cited there, parental cannabis use has rarely been studied as a phenomenon distinct from substance use in general. So work specifically focused on cannabis is somewhat absent or limited in that respect. So what work do we actually have? The vast majority stems from North America. So I don't believe we have any research on parental cannabis use and its relationship to parenting in Australia specifically. It's almost entirely quantitative and cross-sectional in nature. It relies on self-reports by parents for the most part. It's rather myopically focused on measures of risks and harm, and we're speaking here namely of child abuse and neglect. And it tends to assume from the get-go and hypothesize that parental cannabis use is liable to precipitate maladaptive parenting practices, that it's something that's conceived of as a threat to parenting and that will likely engender damage to families. So qualitative accounts are almost entirely absent. There is one article from 2013 that I'll explore in the later slides. But for the most part, qualitative research that looks at people's perspectives, their experiences, and the broader context or circumstances of their cannabis use while parenting is missing. And perhaps unsurprisingly, then so too is any consideration of the possible affirmative, health promoting effects, or even the idea that cannabis consumption among parents might be benign, neutral, or normative. So moving to review some of these findings in closer depth. And here I'm more concerned to look at their findings broadly rather than to critique the methodologies per se. The first one here is Freisler from 2015. It's fairly well cited. It consists of a telephone survey with around about 3,000 parents over in California. Found that current use of cannabis was associated with physical abuse, but not related to supervisory neglect, and it was negatively related to physical neglect. And I'll point out here that current use was defined as using at least once in the past year. So if you indicated that you consumed once in the last year, you're going to be bundled under that category, which is quite interesting and could lead to inflation of their findings, of course. Drawing on the same research sample, Freisler again and Keppel suggested that past year and lifetime use of cannabis amongst parents was associated with high annual frequencies of non-violent discipline and corporal punishment, but lifetime use was associated with significantly lower rates of physical abuse than no use. So again, kind of mixed findings here. Donahue, pretty small sample there, 80 mothers referred to Child Protection Services for behavioural treatment. They found a positive association between cannabis use and child abuse and neglect potential, but that potential was significantly greater when taking place within the context of hard drug use. So important to think through, okay, what does that mean? What are we actually focusing in on when we look at those findings? The last few I'll take a look at here is Hill found that parents who met the criteria for cannabis use disorder but not use were less likely to employ positive parenting strategies. Freisler found no association between rates of child protection referrals and the geographic availability of medical marijuana dispensaries. And Veerseman in 2022, with a broader sample of 266 parents, but only 34 of which indicated that they consumed cannabis within the past 6 months, found that it was associated with negative parenting, but no association with child emotional or behavioural problems. And then the only qualitative piece, as I mentioned, there is the one that 6 medical marijuana patients identified that it helped them to be calmer with their children and to manage difficult emotions related to parenting. It's a very short piece, and I think that that actual theme only constitutes about 2 or 3 sentences of otherwise about a 4-page paper. All right. So despite what might be termed inconsistent, partial, and conflictual findings in the literature, it tends to propagate a series of assumptions and speculative claims around cannabis and its relationship to parenting and child outcomes. And the first is the purported pathways through which cannabis use actually influences the parent-child relationship and parenting capacity. As we can see here, these concerns, these assumptions largely center around the presumed physiological and emotional effects of cannabis use, all of which are described for their purported capacity to impair or compromise parenting, usually as it relates to intoxication. So the top one here, that the concern stems from a maternal inability to safely care for her infant while directly under its influence. They acknowledge, though, that this is a theoretical problem and hasn't been well established in the literature. For isolate here, that marijuana can increase anxiety or paranoia, which may be what prompts physical abuse. And that although no studies have been done on the subject, a mother's ability to care for her child while she's impaired might be compromised owing to cannabis's effect on mood and judgment, which affects, it's not quite clear. That marijuana may contribute to child neglect by reducing goal-oriented behavior, like helping children with their homework, monitoring children, and providing food or other pertinent needs in a timely manner. So again, notably, we see the effects of cannabis use are enacted by and large in negative terms and in ways that are seen as incompatible or antithetical with good parenting, care, and positive child relationships. Just a couple more examples here. I find this one by Schleister again quite interesting. That'll make it that it could make parents difficult for parents to pick up on cues for their children or respond quickly when their children are in danger. It's consistent with neglectful parenting. They may not be watching their children closely enough. It may be linked to physical neglect if parents forget to buy food or don't pay attention to the length or severity of their child's illness. And the last one I'll reference here is that it can disrupt pregnancy-related changes to the maternal brain. So talking about effects at a very sort of neurobiological level, and it might have an effect that decreases your emotional availability and the attachment necessary for responsivity to infant cues. And as a means of kind of evidencing this claim that these authors make, they draw on research on animal models that suggest that cannabis use was associated with diminished pup rearing behaviors. So take that with a grain of salt, perhaps. So another part of these quotes and this research is this idea that cannabis use, that the drug itself is the dominant agentic force in harm in these events. The effects are produced by the drug itself, and that they're causally responsible for harm and risks, while the broader context, the circumstances of the cannabis use and other forces that might be implicated in these events are kind of sidelined or treated as not particularly relevant for the kinds of claims that they're making. But we can see that the assumptions also extend further. They're not just about the drugs and their effects, but also the people that use them, to the cannabis-consuming parent. And here we find parents who use cannabis are positioned as careless, as deviant, as risky, and in some instances as criminal. So on the top quote here, we find that parents who use marijuana for severe medical conditions may find that the time needed to manage their illness may detract from their ability to supervise or care for their children, or that similarly, being in physical pain may make parents less tolerant and less likely to use physical discipline when a child is acting up. So I'm unclear with this one on how marijuana is contributing here, but it seems that if you smoke, that it leads you to stand out as being of particular concern if you consume marijuana. Those parents who use cannabis in an illegal context, it's claimed by Wilson and Ree, run the risk of serious negative consequences and likely have a greater propensity towards problematic use, delinquency, and associated dysfunction, which are quite bold claims, and these are seen to contribute to neglect. And on the last one here, parents who have incorporated marijuana use into their routine activities may stop viewing edibles as a danger to their child and thus be less inclined to store products where children can't access them. Again, if we think about parents who have incorporated cleaning materials into their routine activities, the idea that they might stop viewing those products as a danger to their child and less inclined to store them would be an unusual one, but somehow it seems to stick and be relevant for Keppel, the author of that quote. All right. So collectively then, and despite the limitations and the gaps in the knowledge base on the topic, these works arguably invoke and invite a rather strong skepticism and suspicion towards parental cannabis use and the cannabis using parent, which underscores rather vague and cautionary claims about the need for health authorities to monitor and intervene in parental cannabis consumption. We can see that illustrated here, that even in the absence of solid evidence, that it's critical that researchers and clinicians are aware that cannabis use and abuse may reflect risk or liability towards substance use and abuse, and that it should be carefully assessed and addressed. So these discourses might sound familiar to our audience, and that's because in large part they resonate with a long-standing, pre-existing body of public, professional and policy discourses around parental drug use more broadly, which has tended to constitute the practice as being incompatible with parenthood, and as a practice that invariably poses a risk or threat to children and families. And as Valentine and colleagues pointed out in a 2017 article, there are very few public representations of safe and competent parenting by parents who use drugs. So social science researchers have looked at the ways in which health professionals, for example, position or reify people that use drugs or parents that use drugs as selfish, uncaring, neglectful, and intolerant. And that it also extends to legal discourses as well. So there's a recent paper by Sarah Hyman and colleagues that analysed child protection proceedings and looked at the ways in which parental cannabis use was constituted across discourses there, and judges and professionals' accounts, who tended to link cannabis use amongst parents to deviant norms, deficient priorities, and a lack of motivation to change, as well as used cannabis use, or cited it rather as proof of parents being irresponsible, that they lacked insight into their children's needs, and that they were incapable of caring for their children. So the intensity and the effects of these discourses are, of course, not distributed evenly, and that distribution varies according to class, for example, ethnicity, race, and drug use practices. They intersect with these varied factors, as well as normative ideals and beliefs around permissible and deviant forms of drug consumption, including, of course, ideas around addiction. Gender has been a big focus of the literature today, the social science literature on parental drug consumption. And this work shows the ways in which maternal drug use is often deemed as doubly deviant and especially problematic. So in a UK analysis of drug policy, the problem of parental drug use was largely framed as the failings of mothers, their inability to adequately care for and protect their children. That was by Flax in 2019. Looking at media accounts as well on methamphetamine in the US, as well as child abuse, it tended to focus on the failures of women as mothers, but there was very little discussion of fathers' culpability in that media. In healthcare spaces, again, Benowit describes how women were regarded, or rather their drug use was regarded as fundamentally problematic, and that occurred through the gendered responsibilization of women as fetal incubators and primary caregivers of infants. So it's very much women's and mothers' drug consumption that comes into the frame here, and men are kind of given a pass out of that same kind of scrutiny, the stigma, the surveillance, and the intervention. Importantly, these kinds of discourses, these assumptions, these beliefs are bound up with broader norms, ideals, and governing logics that have occurred around parenthood. And researchers have pointed to the rise of various ideologies of parental responsibilization and individualism in the past few decades, and the growing role of parents as the solution to social problems. So across this kind of policy space and these discourses, parents are reified and positioned as a fundamental determinant of children's future, of their well-being, for the production of productive future citizens, often at the expense of the broad array of structural variables that might be understood to mediate their capacity to do so. An array of expanding array really of parenting experts, usually from the side disciplines, or informed by the side disciplines and neuroscience, as well as parent-focused policies, tend to convey and impart very specific ideas about what it means to parent and how to parent. And accordingly, the sort of good parenting is dependent on the uptake of appropriate, aka expert-sanctioned knowledge, skills, as well as a suite of normative ideals that parents are expected to adhere to. Again, we see mothers and motherhood centered across this field. The good mother is one who is expected to be thoughtful, altruistic, patient, devoted to her children, and fulfilled by a mothering role. She sets aside her own goals and interests, devotes herself entirely to her children, does not make life choices that may impede her child's development. So there's often here then implied a very narrow idea of correct performance of parenthood, a singular conception of a good parent, one that scholars argue is predicated on middle and white class values, that tends to erase the diversity of parenting experiences and understandings of parenthood, and which generally sees drug use as being incompatible with good parenthood and parenting. Now, against these prevailing strands or these hegemonic styles of thought, we've got some researchers that are producing alternative accounts of parental drug use. And these works really seek to challenge simplistic cause and effect associations between drug use and parenting, that it is drugs solely that are responsible for causing harms and the deterioration of parent-child relationships. What they do is highlight the diverse struggles experienced by parents who consume drugs and that affect their capacity to care, including barriers to care, stigma, socioeconomic disadvantage. So a study in Australia, Benwell and Banma in 2006 compared the experiences of mothers who injected heroin with those who didn't use illicit drugs. And the major difference that they found between these groups is that women with low incomes, including mothers that used heroin, have more difficulties balancing domestic work, employment, childcare, and quality family time, and really countered the idea that many parents who use illegal drugs aren't like drug using parents. Instead, they actually share this commitment to producing loving, caring family lives, but encounter different kinds of challenges in the process. Also, researchers like Carly Valentine, Tim Rhodes have pointed out the efforts that parents undertake to actually protect or their children from harm or mitigate potential harms that might occur in relation to their drug use, like keeping their drugs out of reach or using drugs at specific points in time, creating boundaries between their drug use and their children. So these help us caution against conflating parental drug use with child neglect, but also emphasize the need to explore the perspectives and accounts of parenting by parents to draw on their voices and their accounts to I guess, enrich and extend our understanding of what's going on in this space, which, as mentioned, hasn't really occurred with respect to parental cannabis use. I think when we look back at the literature on parental cannabis use, it also highlights some of the limitations of those works or further foregrounds their gaps and their potential implications. I think left unchallenged, prevailing ways of evidencing cannabis consumption might actually serve to stigmatize parents. It could reduce, therefore, their contact with service systems. It might obscure by reifying drugs as the dominant causal force in events of harm or abuse, child abuse, those broader range of forces in those events. So what else, what other levers can we pull to help transform this rather than just focusing our attention on drug use per se? It can prejudice negatively the professional assessments of parental functioning and risks. It can be used to support punitive attitudes and policies towards parents and invite further surveillance of them. And of course, that's likely to occur on class, gendered and racialized lines to affect women in particular. So With this in mind, our research was concerned to address some of the gaps in existing literature and build off those more critical social science research accounts. We were interested to explore how the transition to parenthood actually shapes the practice and experience of cannabis consumption, and vice versa, how cannabis use in these contexts shapes parenthood. How do individuals understand and navigate the effects of cannabis use in the context of earlier or new parenthood? And how do parents themselves articulate the relationship or the nexus between parenting, family life, and cannabis? As said, it's a work in progress. For now, we've got semi-structured interviews with relatively new parents. And by new parents, these are parents who of children of around about 3 years, maximum of 4 to 5 years. The majority, however, are 2 or under. We have 10 mothers interviewed so far, 10 parents interviewed so far, 6 mothers and 4 fathers. And amidst that sample participant group, there are 2 couples. Parents are aged on average 32. 6 parents had 1 child, so the majority. 2 parents that were a couple have 3 children. And we've got 1 parent with 2 kids there as well. They're based in Queensland and Victoria. Now, categorizing the cannabis use is quite difficult given the transformations that participants spoke to and the dynamic patterns of use. The majority might be said to be sort of at least half about weekly or daily consumers of cannabis, mostly joints and smoking. 3 participants described a history of using their terms cannabis addiction. I believe 1 had been diagnosed with a cannabis use disorder. In terms of background of the participants as well, the majority were engaged in full-time work, had a bachelor degree or higher. So I'd classify the group as being from more of a middle-class background. So let's have a look at some of the analysis here. All the participants described quite lengthy, varied, and dynamic histories of cannabis use. That included periods of abstinence, whether that be temporary, extended, changed meanings, associations, and practices of consumption. So it wasn't really consistent, but it was long-standing. Anna at the top here describes how cannabis consumption recommenced in her later adulthood and in relation to her professional life, so predominantly to help her sleep, to manage her corporate job. And on the bottom here, Beck talked about using cannabis to help manage the effects of polycystic ovarian syndrome. I'm wary, though, of conflating the use solely as an attempt to manage well-being or to use the term from the literature to self-medicate. For many, cannabis use was also associated with pleasure, with sociability. It was used to celebrate, connect. It was kind of a banal quotidian practice that enabled opportunities to bond with friends and family members, just as it supported everyday well-being. Now, as parents entered, or rather individuals entered parenthood, obviously they're faced with a whole range of new considerations, new expectations, new responsibilities, all of which shape the proclivity and capacity to engage in cannabis consumption. So, of course, time constraints were a critical one that were mentioned. Kendrick at the top here, he's got shit to do, just hasn't got as much time to smoke cannabis. Jane as well spoke to the limited window of opportunity for being able to use cannabis, the need to get to sleep, and it just doesn't come up as often. So there are all these different ways in which just the practical realities of being a parent meant that cannabis use was reduced in these contexts. There are also different kinds of considerations as well. One thing that I noted amongst the blokes, the 4 blokes in the group, was in that really early stage post-birth was stopping consumption because they were concerned if they needed to drive or provide this kind of emergency care and support for their partner and the child. But also Jake here speaks to these other kinds of considerations that if he shares a joint with someone, he could get COVID, that he could get sick for a week, that his wife could get sick, his kid could get sick, and then they're going to be pulled out of daycare. They're going to get stung for daycare. And there's a lot at stake. So really thinking here amongst the participants that we have new considerations, new demands upon us, and that meant that cannabis use was kind of taking more of a back seat. And in fact, For most of the participants, there was in fact, all of the participants, there was a reported decrease in cannabis consumption. That included smoking or consuming less, also like attempts to not get as high, as Jake says here, not getting as obliterated. People changed their practices. So other things that were factored into the practices and the changing thereof were, I don't want to smoke around my child. So people might switch to vaping as an alternative just to reduce the presence of smoke in and around the house, or using edibles, moving away from bongs and towards smoking joints. And that was in part because, as one participant highlighted, you're going to have more people coming around, and the stigma around bong consumption, but also the hassle of hiding those implements in case you don't be judged by people coming through. Participants, just like the pre-existing literature, spoke to the shifting place times of consumption. So most parents shifted towards consuming in the evening after the kids had been put to sleep, and also shifting their consumption to outside areas away from the child. Another practice was having a sober person around. So if both parents smoked, one might take a time out, or they get a babysitter like grandparents to come into play. I thought it was Kelly's quote here was quite good. These are all pseudonyms, by the way, I should mention. Kelly's quote here, it gets tarry the bong and very gross, and now she's using the laundry sink for washing nappies. Jake also spoke to the priority shifting. We've become a little bit more considerate, responsible, not enough to give up, but just the right amount to be there. Okay, one thing that emerged more forcefully in mothers' accounts were these concerns and anxieties about the possible effects of cannabis use and its relationship to parenting. And a lot of the ways these seem to tie in with prevailing ideas around the need to be constantly vigilant, to be always switched on for a child, and for a mother to be ready and available no matter what the circumstances are. So Anna here talks about, these concerns around the possible ways in which cannabis shapes a judgment. My concern is, could it make me too relaxed so that I become negligent? Could it make me miss a cue? Or that he could be playing with something. She thinks it's fine. He falls off and hurts himself. Also included fears that if something did go wrong, that their drug use would be centered as the problem, that they'd be labeled an unfit parent, and of course that they'd have their child taken away. Other concerns highlighted by Jane, that stigma too here, but also that, a cone might make her severely inebriated, and she wasn't sure how that could affect her parenting, whether she'd be able to hold her shit together in those events where care was demanded. But again, these anxieties largely concern around potential but not actual effects. So talking about the ways in which these ideals of motherhood participate in thinking and concerns around cannabis, and a couple of the mothers highlighted how the men were kind of exempt from these pressures to some extent, as well as the associated feelings of guilt and shame that can emerge in relation to them. So Anna here, her partner doesn't seem to have that mum guilt, that she felt guilty and selfish, that she was having a conversation around a desire to use cannabis when she was breastfeeding, or when she was pregnant, that she wanted to do this thing, that it felt selfish, me wanting to put my preferences before this child. And that was really part of the struggle that he didn't seem to understand. So again, these ideals of self-sacrifice really strongly, that Anna felt that, this cannabis use was something that perhaps that she shouldn't be doing, and was indicative of not putting her child first. Beck sort of supports that as well, the guilt not being felt by her partner, that he's always feels like he's a good father, doesn't experience that same level of kind of insecurity or anxiety around a parenting capacity. He's never had that thought, am I a bad dad? Should we not be having our son tonight, when they've put the son in care of the grandparents? It's more Beck that'll start having those thoughts. All right. This may in part be tied to the more intensive and pervasive exposure to ideals of parenthood, as Jane and Kelly speak to here. It starts when you're pregnant. You have your first midwife appointment. They ask you, do you smoke cigarettes? Do you drink alcohol? Do you do any recreational drugs? If you say yes to anyone, you get seen by a doctor who tells you what you should and shouldn't be doing, how often you should be doing it, whereas men don't get that. They don't have midwife appointments and obstetrician appointments to tell them what they can and can't do, and similar statements around this, that men don't get grilled. Kelly spoke to this experience where she spoke openly, one of the few parents that spoke openly to a clinician about her parental cannabis use and also her past history of heroin addiction. They also spoke with that clinician about her partner's methadone history and present engagement, but it was her consumption that came under scrutiny. He wasn't spoken to about, whether his parenting will be ineffective as a result of his cannabis use. It was focused on the mum. And as Kelly points out, this kind of continued the stigma or the stipulation that mum is the full-time caregiver. Some of these experiences also, or these ideals also participated in the very event of consumption. It shaped the experience of actually consuming, or the effects of what happened when people consume it. I think Beck powerfully illustrates that, this heightened sense of kind of paranoia when she smoked. She also reported experiencing postpartum depression, this idea that when she was smoking, she was more aware of other people around her. She talks about singing or playing guitar to her child, and this idea that she thought she was being too loud and maybe hurting her ears, despite the child being fine, that he wasn't crying, that she was overthinking things, like, am I going to mess him up? I was thinking more about every single thing that I'm doing. Is that going to mess him up? So I think this begins to suggest how these pressures, or the uneven pressures of parenting, create this hyper anxiety that can extend into those events of consumption in the parenting context. And they also seem to engender this felt need to justify time out or space to consume cannabis. The blokes in the group also spoke to this, but again, it was definitely more prominent and forceful in women's accounts. So Kelly here, if I'm going to have a smoke, I want to get all my housework out of the way so that I can relax, that I don't have to worry about thinking about things, that I've got washing I need to do, that I need to stack the dishwasher. Or Beck too, lives with a bit of fear. She wants to avoid being seen as a deadbeat to her kids, so that she tries to continuously stay hydrated, eat well, exercise, go to work, keep the house clean, keep on top of her mental health, do all of that just so that we can be involved in the background without her necessarily feeling bad about that consumption. I really like this quote from Anna, speaking to these transformed experiences and enjoyment of cannabis use now that she's become a mother. She states that it's funny, that ritual of being able to sit down and take a drag, to watch the smoke and look at the sky and the wind. That ritual of having a smoke now is definitely tainted, not in a bad way, because I'm obviously super happy to be a parent. That is and always will be my priority, but it has changed. Because it can't be the exact same it used to be. I have to be very aware of what time I have to smoke. If I'm going to have a smoke, I have to think about what time the child will go to bed. Is he teething? Are we giving him Panadol? What time is he going to need Panadol? There's a lot more logistics that go into it. So clearly parenting was something that was at the fore of our participants' cannabis use practices and their experiences. Wasn't something that was neglected. It actually played quite heavily on their cannabis use and their thinking around it. But I think, too, we can also begin to explore how not only was that gendered in terms of the ideals and how parents saw themselves in response to kind of notions of good motherhood or parenthood, but also in the kinds of labour that was done around the house, and this idea that mum was kind of the default carer. Again, speaking to Anna here, even though I'd smoke weed, one of the great things used to be where a night where you'd smoke weed and you'd have an awesome sleep, you'd get up in the morning and feel really relaxed. But now she's having to get up every 2 hours. She's waking up super drowsy because of that need. I was thinking, why isn't my partner doing that? Again, that's just how parenting is. It isn't always fair. And Kelly, too, spoke to this idea of being the default parent and wishing, when she saw her partner consuming, that she could do that. Feeling like she couldn't do that. So certainly the case of uneven labour in some of these households. Particularly in the early stages of parenthood, was shaping the capacity for parents to enjoy and actually partake in cannabis consumption. Also sort of afforded men the ability or the liberty, as Anna described it, to smoke when they wished, and also to access those pleasurable or positive potentials. So with these things in mind, it was always kind of complex, the ways in which parents spoke to their cannabis use. And for a large part, it was seeing how it would fit into the domestic flows and the rhythms of everyday family life. And particularly given that parenthood resulted in transformations in the kinds of ways in which people were socializing and what they were doing with their time, spending a lot more time at home, and weed was seen as more conducive to that kind of lifestyle. And it was often compared to other drugs like alcohol that was seen to have knock-on effects that would slow your parenting down or negatively shape your engagement with kids. In contrast, cannabis sat within sort of the flow of these dynamics more readily or easily. Also, this idea that people felt like they could have maybe a stronger sense of control over cannabis use, that it was more predictable. Claire here stating that if I'm not ever going to get blindsided by cannabis. Looking a little bit further at some of the affordances or benefits that participants articulated in their accounts, one of the consistent ones was the value of cannabis in fostering intimacy and connection between parents. It was a kind of a ritual, as some participants framed it, between parents and partners that they'd enjoy together, that they'd share. And as Anna states here, to make things more intimate. For Claire, it's a building block of their closeness intellectually. And Jake's comment here was quite funny. He took a break from smoking, and he was like, "Oh, this is kind of working out. I feel like I'm engaging with my partner quite well." And then last night before the interview, he stated that when he was stoned, his partner said, "I think I like it better when you're this way." And he mentioned that he thought that maybe that's because he's a little bit funny, a little less serious, a bit more jovial. And other participants talked about how they kind of like, took the edge off a little bit and meant you could, engage in conversation with your partner as well as your kids, which we'll speak to, and just chill out and be a little bit more present for those interactions. Others spoke, and this isn't uncommon when we think about drug consumption practices. I won't spend too long on it, but this idea is as a tool for managing well-being, and that kind of makes a lot of sense, particularly for those. There were a couple that had pain issues that they managed their pain issues with using cannabis, but also just to de-stress, to stay grounded and connected. For Ben, also on the right here, it was actually helpful for reducing his alcohol consumption. So the kinds of reducing the irritableness and compulsion he might feel to have another drink, it would go away, he would state, because he knew he could be able to have a smoke later on in the evening when the kids went to sleep. Claire also speaking to the ways in which it helps her process or work through things, which then translates into being more level and balanced for the kids and being able to meet their needs. She's seen the difference when she's had long periods where she hasn't smoked anything and starts to feel like there's a bit of a worldly crust that builds up. So looking towards those parenting capacities, in a lot of ways, the parents would talk to how it augmented their capacity to parent, but also to enjoy being a parent. So Claire's quote again, speaking to reconnecting on that important level with their kids. Kelly talking about it not undermining attachment, but actually fostering a more greater appreciation of the child, even in those moments of being intoxicated or high. Beck also talks about cannabis use helping her clean, to get jobs done faster, to move faster and not sit down. She referred to it as a gentle assistance. Men in particular talked about the ways in which you can foster more playful, present interactions, making them feel less silly interacting with the kids, block all of the bullshit out, as Jake said, and see face to face. Brings out your inner child a little bit more, be on the same level and goof around without feeling like an idiot. And I'll remark too that most of the parents stated that it wasn't a regular thing that they did, but there were situations where they might end up where they've had a smoke and maybe the kid wakes up and they're around the child. But certainly so it was the case that most were smoking in the evenings, so they could enjoy their smoking without having to worry about tending to their child. Kelly there, it helps me enjoy him a little bit more and be less stressed about housework and happy to play with them, slowing down to so they connect with the child more deeply and understand them better. So far from being inimical to good parenting or mother-child attachment, it was seen to foster those connections to some extent in some circumstances. But of course, no participants frame cannabis use as innately beneficial, purely positive under every and all circumstances, that it had no limitations of risk. In fact, they're much more nuanced and complex accounts. They conveyed very specific ideas about what's appropriate and responsible cannabis use, which differed according to participants. Surrounding maybe some people thought it was okay during pregnancy and breastfeeding, but certainly not okay during XYZ, or that there were particular amounts. I also tested ideas about it being innately to do with the drug, the effects of cannabis use. As Kelly states there, the effects is as much to do with the parent themselves. The way people choose to parent, irrespective of smoking, is how they're going to parent when they're smoking. Others talked about the effects being contingent on the day, the mood, your state of mind. So a much more nuanced treatment of how these effects might emerge. I'll just finish off here on this quote from Jake, because I think it helps. I thought it was a lovely quote, but also I think it helps kind of illustrate some of the themes today and in quite a nice way. He stated, when I asked him, what does it mean to be a good father, and how does cannabis use relate to that? He said, I just want to be there. I just want to be here for my daughter. I wanted to feel connected, to feel protected, to feel safe. I wanted to feel challenged all the time, to be learning, like on the go all the time, to be creative, do drawings, sing songs with her, do performance and shows and watch TV together, introduce her to Miyazaki films and reggae films. And in essence, that's kind of what I feel like I'm doing, just being depended on and dependable. I think the way I rationalize it, that if I'm doing all these things and it's not being inhibited by any stage of our time together, my cannabis consumption is not an issue. All right, so just summary points. I see we're going over time a bit, and I was keen to open it up for questions. What we see is that current evidence on parental cannabis use is nascent, it's fledgling, it's limited, and as I've identified, I think there are a series of questionable assumptions within it. For our participants in this particular ongoing early study, Parenthood reconfigured cannabis use in diverse ways. Those reconfigurations were underpinned with real consideration to their parenting and conscious attempts to be good mothers and be good fathers. It was by no means innately problematic or harmful. In fact, for our participants, it afforded positive and pleasurable potentials. But these experiences, the possibilities to engage, the anxieties, the stigma, and the concerns were profoundly gendered, and they were shaped by particular norms, expectations, and discourses around cannabis use and drug use. What are some of the implications here that I've jotted out? I think this is worthy of discussion. I don't think this is the be-all and end-all. I think it does suggest the need for people, the community more general, but also professionals working with parents that consume cannabis, to be mindful of ways in which current evidence might actually reproduce problematic discourses, or in the words of Flax, be laced with prejudice. To resist the a priori conflation of parental cannabis use with risk and bad parenting, to actually explore the context of that use and what other factors might be contributing to any instances of, say, neglect or abuse. To foreground and collaboratively explore the context of that use, again, by engaging parents and listening to them and recognising how they articulate the potentials of cannabis use. To recognise parents' reflexivity, their agency, their familiarity, and their expertise with cannabis use. Every one of our participants have been using for a long time. They were familiar with it. To respect that expertise and experience, but also to interrogate how our own practices, our own interactions, our discourses, our ways of talking about cannabis use might actually reinforce stigma, scrutiny, and regulation in uneven ways. Like, for example, giving men a pass out of responsibility while keeping the lens firmly entrenched on women, which we'd like to avoid. So I'll conclude there. I hope that wasn't too quick. Thank you very much for listening. Open up to questions.
Thank you very much, Tristan. I do have a number of questions for you. I'm going to ask them as they came through. First question, is there more or less maladaptive parenting in countries where use is legalised?
I think that research doesn't exist yet. Yeah, or I mean, if you're looking at those that actually draw the link between legalization and cannabis, that doesn't exist other than in North America. But you'd have to go out and compare the rates of child abuse and neglect somehow in other countries. Yeah, it just hasn't been done. As far as I'm aware. Sorry.
Thank you for that. Look, you may or may not recall this, but there was a quote early on about the mother's ability to care for their child. Are there studies relevant to a father's ability to care and or relational dynamics between parents in which one or more members uses cannabis and how that affects children?
The 2013 study by Thurston included parents, so men and women. It's really short. Otherwise, our research might be one of the few. There are papers done on substance use generally that might include odd bits of insights into cannabis use in parenting, but as far as I'm aware, not really. No, there isn't. Except in the instance that doesn't really count as parenting, but well, sorry, I'll leave that up to the audience to judge, but in pregnancy, so specifically concerning pregnancy, and they'll engage some men around their ideas around the perceived risks and harms of cannabis use in that context, but not on relationships with kids and attachment, etc. Again, as far as I'm aware.
Thank you. Thank you. Have there been comparative studies for parents who use alcohol?
Yes. One of those that I cited at the very least, I'm not sure, I'm still sharing screen. Sorry.
Yeah, you are.
Let's through this just to get you the right answer. It was, I think it's Hill. I think it's Hill 2018 compares against different drugs. As well as Donahue, or maybe it's Donahue as well, as because they looked at hard drug use as well and definitely included. Yeah, you'll have to check these resources, but these are basically every single one that looks at cannabis use, again, as far as I'm aware. So yes, it's been done.
Thank you. The studies mentioned situations where someone may be, the studies mentioned are these situations where someone may be considered to be intoxicated from cannabis use rather than a slight impairment. For example, someone using illicitly to experience a high in comparison to someone choosing to microdose, such as medical cannabis prescribing.
If we're talking, I'm going to take that as referring to the quant literature that we reviewed. And that's like, I believe one of the key limitations of that work, which is inattention to the context of cannabis use. So maybe some include more specific measures, but by and large, they don't investigate down to the specifics of the cannabis use practices themselves. And as I said, like in Freisler's instance, their current use is just if they use cannabis once, it's not clear if it was an edible, what the potency was. Any details surrounding that use, and presumably the findings are held, at least by these authors, as being useful in that regard, that we can understand these relationships in isolation from really any depth of understanding of what kind of cannabis use that was undertaken. So no, I don't think it's properly canvassed. I think it's overwritten. Yeah.
Is there any research on a child or children's views of parental cannabis use?
Yeah, there is. Not qualitative. It is the Hill study here, which included 363. So that's a longitudinal study. There was a follow-up over a long period of time. And for that particular publication, I believe it was when the kids were 9 years old, they got the kids to report on the parents' parenting strategies. So they used like a scale, I believe, to assess positive parenting. So it was the kids' quantitative assessment of their parents' parenting, and then they also then asked the parents, I believe, about their cannabis use practices.
Thank you. This person wrote, great and thought-provoking presentation, Christian. How are you recruiting your research participants?
A few different avenues. It's actually been quite slow. It emerged as an offshoot of a broader project that we're doing on alcohol consumption during the COVID-19 pandemic, and cannabis use just popped up. So we're using some of the same recruitment avenues, which was advertising on Facebook, which wasn't very successful, probably because of the stigma that surrounds it, but also because of our narrow window of participants that we were looking for, which was like new parents of kids less than 5. Social contacts as well, and ended up contacting a bunch of cannabis advocacy groups, websites, and asking if they could spread the word. It was advertised on Cannabis, and there was a mothering group that was on Canam, I think called Canamums, that distributed the work as well, or the research.
Thank you. Was there any consideration given to polydrug use and the impact of other substances as opposed to just cannabis?
I'll take that as being in our own research.
In your work, yeah. Sorry about that.
When we spoke, I kind of would ask them to speak about specifically cannabis use, and the only other drug that came up as being used at the same time was alcohol, and in low quantities. Like, for example, Kendrick, he would always smoke with a beer on the balcony while watching the sunset. And maybe there could have been some mild intoxication, but it wasn't discussed as interacting. And a lot of the participants actually just stopped drinking. So it wasn't something that we investigated with intent.
Thank you. So I'm just conscious of time. Unfortunately, everyone, we're not going to be able to answer all of your questions. We might go through another couple if you're okay with that, Tristan.
Yeah, sure thing.
What are the statistics of children using cannabis whom are or have been in the care of parents who use cannabis?
Ooh,
and do you have an age group, if there is any?
No, it's kind of its own kettle of fish. I think there's actually a lot more. The research that kind of predates this, that did include a focus on parent, is really centered on that. How does parents' cannabis use affect their kids' later trajectories of cannabis consumption? And it hasn't been something that I've explored, but it's certainly out there and growing. I can't quote any numbers.
Thank you. There was a number of questions and comments around child protection. Mm-hmm. This person's written, the people in this study appear to be very different from the kinds of parents who end up in children's court matters, where they do not do the things these people have done to protect the children. Do you have any comment on that?
I think the people with this, I'd say that the people involved in this research differ from the majority of people involved in child protection services, in that they don't experience socioeconomic disadvantage. There were no people of colour in the group, and they're middle class, largely educated. So as I've kind of sought to emphasise, is that there is a broader suite of forces that mitigate the effects of cannabis use, as well as parenting practices. And that ties in with a whole range of inequities and social cultural conditions. And I would really urge, and that's part of the critical thrust of this research, any clinicians in this space to examine how that context is shaping the way cannabis is used and the way in which it shapes parenting itself, rather than centering the drug and the individual's drug use practice as the principal agent in harm. And in no way, and I'll emphasize, though, I think that, cannabis can't contribute to harms or negative parenting. Absolutely not. But I would argue that we need to look at the contingencies and circumstances that surround that. And then that's more productive because it gives us more avenues for transforming those harms that children can experience as a result, or in the context of, drug use in families.
Thank you so much, Tristan. And I think we'll finish with this one. Great to see this research coming out. The living experience voice is so important. The prior research seems to be from the perspective of third person. Do you think there may be some discrepancies between participant self-reported parenting experiences and professional observation? And could the professional observation be impaired by bias or stigma? And then ended with, hopefully see more of this research.
Yeah, absolutely. And I think that's been, I think on the final slide there, that was one of the comments made by Boyd in 2022, that like these instruments and our whole knowledge making around cannabis use is geared towards a particular view that sees it in a negative light. So the whole assemblage of research and knowledge is entrenched and informed by these understandings. And I think that's also within the disciplines as well. So it's kind of like, it's preloaded. All of the hypotheses in the research that I looked at were seen to consider it as a liable threat. There was no, it could just be chill. It could be fine. It could be benign. It could be normative. There was none of that. So I do think that it does have a role to play in shaping the kinds of knowledge that's produced, those discourses and understandings. If that captures it.
Thank you. Thanks again for your time, Tristan, and a number of questions about when will your work be published? ASAP, within the next few months. Thank you, and apologies to everyone if we didn't get to your questions. Thank you so much.
Thanks, everyone.
See ya.